Namaste everyone, I am Dr. Amit here. Hope you all are doing well. Welcome back to my YouTube channel at the red Dr. Amit Official. So it's a place where we simplify medical science for easy understanding. So if you haven't subscribed it, make sure to hit that subscribe button and stay connected for more useful videos. So in our last video, we discussed about catecholamine synthesis and tyrosine metabolism. Now we are moving forward in our biochemistry series, and today we are going to talk about very important topic called phenylketonuria, okay, PKU, okay. And this is a key exam focused topic for your MBBS exam, PhD exam, and USMLE and NMCL exam. So stay focused and let's get started with our today topic, phenylketonuria. So let's start our today topic, phenylketonuria. So it is a genetic disorder, okay, in which phenylalanine, which is essential amino acid, cannot be converted into tyrosine, okay, and it is an autosomal recessive, okay. So in our previous video we saw this chart, right? And over here we talked that this phenylalanine essential amino acid is getting converted to tyrosine, which is a precursor for all these things, okay. So if this enzyme phenylalanine hydroxylase is absent, then the patient will suffer from phenylketonuria, okay. And now we are dealing with these stages, okay. So normally what's happening, this essential amino acid phenylalanine is getting converted to tyrosine, and the enzyme used over here is phenylalanine hydroxylase, that also called in short form PAH, and the cofactor we are using over here is BH4, that is a tetrahydrobiopterin. So actually what happened in PKU, this enzyme is deficient, okay. What is deficient? This enzyme is deficient, okay. So when this enzyme is deficient, then the phenylalanine will increase in our body, okay, and the tyrosine will decrease in our body, and that will lead to increased phenylketones in urine, okay, because of this. Now there is one alternative pathway, okay. In the alternative pathway, this excess phenylalanine, okay, will convert itself into phenylketones, okay. The phenylketones name as phenylpyruvate, phenylacetate, and phenylactate. So it means when this phenylalanine is not getting converted to tyrosine, that it will accumulate in our body, and when it will accumulate in our body, it will take some another pathway, okay, and from another pathway they will make phenylketones, and these phenylketones are very toxic to our brain, okay. So one is this, okay. The second thing is we also need this cofactor BH4 to convert phenylalanine to tyrosine. So suppose if tetrahydrobiopterin is deficient, okay, then it's an essential cofactor for this enzyme called phenylalanine hydroxylase. So its deficiency mean phenylalanine will increase in the body, then it will cause varying degree of severity, okay. Again it will form phenylketones, and if the patient will not treated for this, then they will die in infancy, okay. Now the another important aspect of this phenylketonuria is phenylalanine embryopathy. Now what happens over here, let's see. Increased phenylalanine level in pregnant patients. Suppose a woman who is a known case of phenylketonuria, okay, and in her body phenylalanine is in increased level, okay. Now and the patient is not getting treated for this, then what will happen, the increased level of phenylalanine will cause fetal growth restriction. The fetus inside the mother body will have growth restriction, they will have microcephaly, small head, intellectual disability, or we can say that there will be less brain development, decreased brain development because of these phenylketones. Then they will have congenital heart defects, okay. So how to decrease this? So it can be prevented with diet measures, okay. So we can follow different diet measures in case if any pregnant patient has phenylketonuria, okay, to increase the level of phenylalanine, okay. Now we'll move further and we'll look for the screening and findings. Now let's see. So while talking about screening, okay, suppose any baby is born, okay, then when we'll screen that baby for this phenylketonuria, okay. So we'll do screening 2 to 3 days after birth. Why? because we'll find normal at birth because of that maternal enzyme. Maternal enzyme will work and will not find that deficiency, okay, so, of that enzyme, okay. So we'll do the screening 2 to 3 days after birth. Now what will be the finding in the baby, okay? So the child will have intellectual disability, they will have microcephaly, then seizure, then hypopigmented skin. Why hypopigmented skin? Because the thyroid will not form melanin, okay. Then the pigmentation will decrease, then also eczema. Then this is very important, okay, musty body odor, okay. This very buzzword, okay, important buzzword for this phenylketonuria. That's a musty body odor comes from the baby, okay. Now how we'll treat those patients, okay? So there is already more phenylalanine in the body, so we have to decrease phenylalanine in the diet, okay, the first thing. Second thing is we don't have enough tyrosine because phenylalanine is not getting converted to tyrosine, so we need to increase tyrosine in diet, okay, like soya products, chicken, fish and milk, okay. Then if there is BS4 tetrahydrobiopterin supplementation, if there is tetrahydrobiopterin deficiency, then we'll supplement this BS4, okay. Then one thing, this is very important part, okay, always avoid this high protein diet, okay, high protein diet, because that will increase the phenylalanine level. Now the second thing is a patient with a known case of phenylketonuria, okay, must avoid a artificial sweetener, okay. So we use a artificial sweetener called aspartame, okay, and this aspartame contains phenylalanine, okay. So if any patient with PKU will take this artificial sweetener, then he or she will increase the phenylalanine level in their body. Again the same problem will arise. That's why aspartame should be avoided in patient with PKU, okay. Now remember here, this phenyl, just remember this chart, okay. This phenylalanine is getting converted to tyrosine with the help of phenylalanine hydroxylase and PS4. So in PKU this might be deficient or this might be deficient, okay. Or we can get phenylalanine from aspartame, this artificial sweetener, or endogenous proteins, okay. Now if this is deficient, then tyrosine will not form. If tyrosine will not form, then thyroxine will not form. If thyroxine will not form, then it will affect the brain development and metabolism part, okay. Then dopamine, this norepinephrine and epinephrine part, okay, fight flight, then vasoconstrictions like activities will not happen, okay. Then melanin, which will give pigmentation to skin, eyes, okay, so that will not happen. So we'll have hypopigmented skin, okay. So this is all about phenylketonuria, okay. So if you like this video, so please do share with your fellow medicos. This is all about phenylketonuria. Now I think you can solve all the MCQs or any SAQs from the phenylketonuria. So it's a very important topic for your any competitive exams. So if you like this video, please do like, share my YouTube channel, and keep studying hard. We'll meet in the next video with some important topics from the MBBS subjects. Thank you.